right, another episode of Move to Improve for you. I'm your host, Dr. Matthew Jurgis, here downtown Proactive Health Group. That's where we're coming out of. And so today I'd like to introduce our newest addition to Proactive Health Group. His name is Dr. Jatish Kaler. He is a doctor of naturopathic medicine, and we're here to talk about something that I'm particularly interested in because I've had several kind of firsthand experiences with what is known as IV therapy. And what I found is on at least 3 occasions when I had been coming down with something, and I knew, you know when you're not feeling good, you're low energy, you're feeling weak, you're feeling cold. And I've had IV therapy, and it's just made a phenomenal difference. So I'm so glad you're coming on today, because I genuinely would like to know what's the background, what's the science, and what kind of new information can you bring to, can you enlighten me with. But also, this is a good opportunity to introduce you. You're a fantastic guy. Love that you're with us here at the clinic. Great addition. So what's going on today?
Hey Matt, thanks for having me on. First time on a podcast, so hi to all the listeners out there, and I look forward to sort of deepening your understanding of what I do, and hopefully also the same for Matt. Hopefully he comes away learning a little bit more about naturopathic medicine and IV nutrient therapy. So start off with the first question: IV nutrient therapy. So this is actually a therapy that was developed back in the 1970s by a medical doctor named Dr. John Myers. So he was a pioneer on the forefront of understanding that there's more than just pharmaceutical care when it comes to managing your health. He started to actually experiment with providing his clients with the fundamental building blocks of nutrition to help their bodies run at an optimal level. So by doing that, he actually noticed great improvements in a lot of different health concerns and conditions. And from there on, he started to sort of expound the benefits, and that's where the research started to flow as well. So there's more research that needs to be done. That's something that I need to be said. But clinically speaking, doctors, medical or naturopathic, have been doing IV nutrient therapy for decades now in a very safe setting, and we've seen great results for clients on an individual basis. So we do need to be careful about the claims we make when it comes to IV therapy. When it comes to the FDA and Health Canada, we need to make sure that we're backing things up with double-blind, placebo-controlled trials in a lot of cases. So when I'm going to be making claims right now, this is not going to be taken as medical advice, but more on an intellectual basis. Okay, so one of the first things to talk about is the advantages of IV therapy is the absorption, the absorbability of accessing nutrients directly in your bloodstream. So if you're supplementing orally or you're eating nutrition, as we should, your absorption rate for most nutrition is about 30 to 50% of the nutrition in that food. Factors vary. If you're really stressed out, your body's not in that rest and digest and assimilate mode. So if you're somebody that's burning the candle at both ends and mental and emotional stress is high, your ability to absorb is compromised. Medications can interfere with your ability to absorb as well. Antacids are the biggest culprit. Anything that shuts off your body's ability to produce acid in the stomach inhibits your ability to break down proteins and molecules in the food and then actually access the nutrition. So antacids are only meant to be used short term, but as we see in clinical practice, they're used for weeks and weeks, if not years on end.
That can't be understated enough, I feel like, because we all, I think, know people who are just popping Tums like nonstop every other day, or they're on their you can get at Costco like a kilogram of antacid medication or proton pump inhibitors for for your gut, and that's all gonna just crush your ability to absorb, right?
It's really just sort of managing symptoms. So heartburn is reflux oftentimes, and so the natural pH of your stomach being about a 2, that's highly acidic. And that's what we want it to be at. So by shutting off your stomach's acidity means you're just turning off its functioning. So you're putting a Band-Aid over top of a problem that we need to fix from the inside out. And so as a naturopath, again, it always comes back to the gut. We're already talking about the gut right now, and we're supposed to be talking about IVs. Well, we're always discussing the gut with our clients. We're talking about the foods they eat. We're talking about, the ways they prepare those foods. We're talking about the ways in which they consume those foods. And as well, we're having a detailed discussion of their digestion and absorption. We're talking about poop all the time. We're talking about, what foods do you crave? What foods do you have an aversion to? How often are you having a bowel movement a day? Is there any pain? Have you had any of these issues addressed at the root level? And then we always talk about food sensitivities as well. If you're consuming foods that don't agree with your body's constitution, again, you're introducing inflammation into your digestive tract. When there's inflammation, you further shut down your ability to digest and absorb.
Yeah, that's 100%, everything you said right there. And I personally have an autoimmune disease, and in my experience, it's been 100% related to diet, and should have listened to my body earlier. That's all right. I got time now. But I think with almost everybody that has an autoimmune disease, there's some kind of food that is just inflammatory for them. And I'm sure this is prevalent across, all people, autoimmune disease or not, but maybe abundantly obvious with people that have those autoimmune diseases. There's so many food sensitivities nowadays, and you can ignore it for so long and maybe put up with a stomach cramp here and there, but then it catches up with you, right? So back on topic, it seems that a lot of people are having digestive issues, maybe aren't absorbing. Right. The
100%. Nutrition in the soil isn't necessarily the same quality it used to be. We're not cycling crops as we used to. We're looking for the highest yield. We're looking for the biggest tomato, the biggest piece of fruit. And oftentimes, the bigger it is, the less nutrient dense it is. So, oftentimes we're very well fed in North America. We have an abundance of calories, but not an abundance of nutrition. Right, so we've got a lot of protein, we've got a lot of fat, we've got a lot of macros, but we don't have a lot of micros in our diet, and so that's where IV nutrient therapy can sort of supplement and cover the bases on maybe an inadequate diet, maybe an excessive lifestyle. People that live in the downtown core here, there's a lot of imbibing that can be done, and we know that alcohol as well impairs your ability to absorb. We don't make the same sort of food choices when we drink, and then as well, we find that people don't sleep as well when they're drinking alcohol. That's another reason why our ability to absorb and repair is diminished. So with IV nutrient therapy, we're actually trying to supercharge your ability to repair the body. We can actually administer anti-inflammatories into the bloodstream as well, whether it's a vitamin or an amino acid, and as well when it comes to things like autoimmunity, we can manage inflammation a little bit that way as well, in a way that we can't when we take a supplement by mouth. Again, we're getting into the stomach where there's acidity, and again, with acidity, we break down foods. Well, that actually can break down molecules that we want to absorb into the body in their whole form. And so with an IV, we bypass digestion, and we can get things into your system that we wouldn't otherwise in the mouth.
Right, directly into the bloodstream.
That's right. So the Myers cocktail was basically a combination of electrolytes, and vitamins. Mainly, we're looking at magnesium, potassium, calcium, zinc, selenium. Those are the minerals that we often will put into a bag. Magnesium is a muscle relaxant. It's also a nervous system relaxant. So if I see a lot of tension in somebody's low back, in their shoulders, if they're experiencing a lot of menstrual cramps, a lot of headaches, these are all versions of muscular spasms. And that's where I look at magnesium to help mitigate those symptoms. A lot of people are deficient in magnesium, especially women, and so symptoms of magnesium deficiency can be managed with an IV that contains a supraphysiological dose of magnesium. Same thing goes for B vitamins. Again, B12 is one of the hardest vitamins that we can absorb, and we can only get it through animal products. So vegans and vegetarians need to supplement with an alternative source, or they'll often find their levels are low, and an IV vitamin treatment will bring up their levels, and then they'll notice major changes in their energy and things like their red blood cell status as well.
Cool. Yeah. And those are vitamins that I typically recommend too. And yeah, it makes a profound difference. I've experienced that firsthand. And so what can someone expect when they get an IV afterwards, that following, because in my experience, it's you kind of come out of it feeling a little bit woozy sometimes. Sometimes you just feel normal. If I can go on my own experience, when I have felt like I was getting sick, I'm here, so it's pretty convenient for me to just go get an IV. Just go do it right when it's it's happening. Maybe it's a day in. And my most recent time, felt ill, came in, got an IV. That night, I sweat. I had a big fever. And the next day I had no symptoms. No symptoms of feeling ill at all. It's like I just had a fever, and then I just skipped that usually 3 to 4 days or 5, 6, 7 days,
right,
where you just right, like I just walked right over that. So that's my personal experience, and I've had that experience a couple times. But what can the typical person expect coming in?
Yeah, we'll hopefully have some time to get into, the antiviral properties of an IV and how that can be harnessed. But when it comes to getting an IV, I always like to ensure people have had something to eat that day. People that come in without having eaten, that's maybe where they feel a bit of that wooziness or dizziness, especially if somebody's not used to fasting. So, I do have clients that come in a fasted state, but that's because they're used to it, and I don't have a problem in that sense. But getting a high dose vitamin C treatment sometimes can drop your blood sugars, and that's maybe where the wooziness will come in. So I always make sure people have had something to eat substantially before they come in for a treatment, especially their first time. And then at the same time, we always have juice boxes and granola bars handy, just like in a blood donation clinic. So anytime there's a needle involved, there's blood involved, adrenaline surges occur, and then you can have sort of a vasovagal or a fainting reaction. So again, I always make sure people are comfortable. We have nice comfy chairs where you can get your feet up, get blood flow to your head. And we make sure that people know that they're in charge during the whole process. I like people to know that, if at any time they feel uncomfortable, we can stop, they're in charge. Patient autonomy is always important to understand. But that being said, it's a very pleasant and painless experience for the most part. There's a little prick when we poke you with a needle at the start, but we take that needle out the back end, and all we leave into your arm is a plastic soft catheter or tube. So, clients are usually surprised by that. They realize that they can actually move their arm. If they need to go to the washroom during an IV, they can get up, they can go to the washroom. If they're a hand talker, they don't have to worry about being stiff as a board. There's nothing in their arm that's going to poke them. And so people find that, again, a quite pleasant experience.
Gotcha. Yeah, it's really quite easy on me.
Sometimes there's a little bit of lightheadedness or euphoria that people will notice too during the IV. I attribute that to the magnesium in there.
Right.
Often, magnesium, again, being a muscle relaxant and a nervous system relaxant, people do sort of feel a little bit of a chill out effect. Some people say they feel like they need to maybe even have a nap during the IV. Right. And I always joke to them, I don't think it's my sort of calming demeanor. I think it's probably the magnesium in there that's giving you a little bit of that feeling.
Yeah.
Most people don't find it to be, untoward. They actually find it to be almost pleasant in a lot of ways. We can slow the IV down if we do feel like the magnesium's hitting a little bit too fast. But again, I often find after an IV, when they get that experience, they find for the rest of the day, symptoms of stress and anxiety are often a little bit more diminished as well. And often they'll attribute themselves to having a really good sleep that night as well, because of the magnesium there that sort of, relaxes the mind, relaxes the body, and just sort of pushes you in the right direction of getting a restful sleep.
So you can have a kind of more abrupt response to it, abrupt in the sense that you feel that immediate relaxation or potentially kind of that like subliminal, maybe more of a long-term change.
That's right.
Depend if you have a deficiency or not.
100%.
If what kind of IV you're getting, because there's different kinds. Right?
That's right. So typically with a straight nutritional deficiency, let's say commonly B12, most people will feel pretty immediate effect. So it'll be either that day or the next morning. They'll notice a big change in their energy, a big change in their mood, and then they'll notice after about maybe 24 to 72 hours, it just sort of fades away and drops off. And so I try to remind them, or at least sort of acknowledge that quick diminishing return is the fact that your body sort of used up what it needed to, put the rest in storage, and oftentimes it's ready for another boost at that point. So people that are extremely deficient will often come in for more frequent treatments at the start, and then as we start to build the body up, they'll notice they're not getting that same sort of boost when they come in, but they're also not getting that same crash after. They're feeling like they're coming in well rested with good amounts of energy, and then by that fourth or fifth treatment, they feel like their energy sort of sustaining them to the next treatment. And at that point, we're looking more at a maintenance treatment plan. So, every 6 to 8 weeks, clients will come in. Or I have some clients where it's just sort of that same old feeling comes back. And if they sort of make changes to their diet, their lifestyle, maybe they start supplementing at home with some of these vitamins, then the IVs are something that they maybe only need once every 4 to 6 months.
Gotcha.
Yeah,
Okay.
unless there's a chronic issue going on there. And for some individuals, we think maybe it's a genetic concern. There is maybe an autoimmune issue. Maybe they're not changing their diet or their lifestyle or their habits. Well, then in that case, they'll often notice they can burn the candle at both ends, but then getting an IV treatment once every 3 to 4 weeks is what can at least let them live their best life.
Mm-hmm. Yeah, be at your optimum, right?
Yeah, whether it's, again, doing naughty things like not sleeping well, or I get a lot of high performance individuals in, right? So, running a triathlon is an extreme stress on the body, and, taking a healthy activity and doing it, excessively can make it a stress on the body. So, IV nutrient therapy is a way to take a little bit of that burden off.
So why don't we go into what the different forms of IV therapy are, like in forms of different kind of types, all right? You got your Midas cocktail and all that, and obviously that's different from something you would probably get in like a hospital setting where it's just saline, correct?
Right, yeah, there's lots of different medications you can put into IVs. In Alberta, naturopaths aren't necessarily able to prescribe, but in BC where I've trained, we do have more access to pharmaceuticals. So I think there's immense benefit to having, access to both pharmaceuticals and the natural medicines, and I think that integrative approach is important. In the hospital setting, a lot of individuals that have chronic migraines and headaches will be given a normal saline bag, so a salt water bag, and you'd be surprised by just hydration, how much that can do for an individual. Anybody that goes to the hospital and in distress will often be hooked up to an IV fluid bag. And again, it's a physiological stress on the body that can be mitigated by providing people with salt and water, even above and beyond what their needs are. Magnesium can also be added to the bags in the hospital. They'll do that for, again, people with migraines and headaches. And so if individuals that I have as clients are experiencing a migraine, they'll come in acutely for that. They'll also do it on a maintenance basis and find they're getting less of them, they're less severe, or in some cases they're not having migraines at all if we treat it with magnesium in a maintenance basis. They also, in the hospital setting, provide NAC. It's an amino acid. So in a very specific setting, it's in overdose settings. So individuals that are going to the hospital overdosing on alcohol, on pain medications, on prescription drugs, oftentimes what they're doing is they're damaging their liver. And so the liver, trying to detoxify the body, is overwhelmed, and it's run out of its sort of rate limiting step, which is glutathione. So glutathione being your master antioxidant. It's the most important in your liver to get rid of toxins. So alcohol being a major toxin, people that are overdosing on alcohol and that are causing liver inflammation, when they get to the hospital, they're actually being administered a glutathione precursor to decrease that inflammation load. We also do that for clients in our clinic as well. Preemptively, it can be useful, again, for liver health, for people that are sort of taking a lot of prescription medications, that are drinking more than the recommended amount of alcohol on a daily or weekly basis. These are sort of damage mitigating steps that we can do for individuals too. So again, an anti-inflammatory glutathione that we can't take orally because it would just break down in our stomach acid. We need to administer it in an IV, and that's sort of what we do as naturopaths.
Right, and just outright, you don't absorb it through your typical digestive system, eh?
You can take the precursor NAC and your body will absorb that, and then you have to make it inside of yourself. Or you can take a glutathione that is sort of liposomal. So what that means is it's sort of encased in a special pill that allows it to absorb faster in the stomach and bypass the stomach acid. Or you get one that's absorbed sublingually or buccally in your cheeks and under your tongue. It's a very unpleasant tasting vitamin, glutathione. So that's sort of one of the issues with the compliance. And again, you're really not getting near the levels that you would be getting by just getting it into a vein at that point.
Or you just put it right into your bloodstream.
That's right, exactly. But yeah, you can get it in your cheeks. You can order a liposomal version, which is extremely expensive. And in my opinion, you're still not getting the same bang for your buck.
So the research, and I know this is going to be a difficult one for several reasons. For one, lack of research, and for two, there's different kinds of IVs that can be infused with different kinds of vitamins and minerals at different amounts and all that. What do we have so far on research, though?
Yeah, so there's a lot of case studies and clinical research out there, which again, if you're in the medical field, you realize like that's gold right there. What you read in a textbook isn't necessarily how you practice in real life. So, getting to know from clients' experiences and from doctors' experiences the benefits of IV nutrient therapy, that's sort of the most knowledgeable way that you can get informed. But if you want to go to the research and the literature in PubMed and online, what we've seen a lot of curious results from is again going back to that magnesium and that muscle relaxant sort of tendency of magnesium. So intravenous magnesium has been used in trials to help abort asthma attacks in people. So people that are actually having bronchospasms, they're having constriction in their lung airways. By giving them intravenous magnesium, you're able to open those lung airways up and abort an acute and severe asthma attack. It seems to be most sort of beneficial for those severe asthma attacks. So again, for somebody that's got mild to moderate asthma and they're experiencing an attack at that moment, they're going to use their inhalers, right? But naturopathic and medical doctors have been using IV magnesium prophylactically in asthma patients, and they have seen some responses there. So mild, moderate, and severe patients will come in on a sort of semi-frequent 4 to 6 week basis, get their IV magnesium, and they're noticing, their exercise-induced asthma is less severe. They're noticing their seasonal allergies that can trigger their asthma are less impactful. So that's one thing that we'll see, and there's research to back that up. There's also research to back up magnesium helping with hypertension or high blood pressure. Same mechanism. Instead of in the bronchioles or in the lungs, it's in the smooth muscles of the arteries and veins. So by relaxing those, we decrease the pressure on the heart, we decrease the pressure in the bloodstream. And that, again, is beneficial to decrease heart attacks and strokes and prevent congestive heart failure in an enlarged heart. Now, we do see research that shows some benefit. Again, we need more trials, we need bigger studies that are more double-blinded, but we do see benefits to people with, again, tight muscles. So they'll see it sort of for chronic pain. And one of the biggest studies out there was for fibromyalgia. So fibromyalgia is a poorly understood disease or syndrome, but what we've seen is managing that mentally and emotionally and with holistic approaches. It does seem to be the best approach. And one of the ways that you can manage chronic pain with fibromyalgia is through IV magnesium. Same thing. Painful menstrual cycles can benefit as well. Anxiety and insomnia. These are all areas that research has shown benefit towards.
Yeah, that's a wide net, right? There's a lot obviously there, and I think a lot of people suffer from that type of stuff.
Mm-hmm. And 20 to 50% of the population, I'd say probably closer to 30% of the population isn't getting adequate amounts of micronutrients in their diet. So, you don't need a study to tell you that when you're deficient in B12, any way that you can get it up, whether it's an IV, oral supplementation, or an intramuscular injection, that's going to help people with a lot of different health concerns because they're all related back to the vitamin B12, which is important for many different metabolic reactions.
Right.
Same thing goes for vitamin C, same thing goes for magnesium, same thing goes for a lot of the other B vitamins that I see people deficient in as well. So if you're deficient in one of the B vitamins, I often see a pattern where you're deficient in numerous ones as well.
Right. Yeah, especially if you have a digestive issue.
Exactly.
You probably know it, right? Okay, so yeah, that's great. It's great to know that there is that scientific backing, and I can definitely speak from honest to God personal experiences where I felt like I escaped death when getting sick from just getting an IV.
That's the antiviral properties and the antibacterial. So again, that goes back to the concentration gradient. I use a lot of high dose of vitamin C in my practice, and when I say high dose, there's no way you can get this dosage of vitamin C from taking it by mouth, right? So one of the things many people know about vitamin C when they're taking it orally is, your bowel will tell you how tolerant you are taking it. So, getting 500 milligrams of vitamin C at breakfast and then trying to get another 500 at lunch and another 500 at dinner. That's the best way to sort of divide it up through the day and get an extra 1,500 milligrams. That's a good way to sort of start. Some people actually have a clinical benefit from getting closer to the 4 to 5 gram mark, but that involves taking 500 milligrams 8 to 10 times a day, right? And so at that point, people will notice they're having looser stools, they might be having stomach cramping, and so getting an IV is a way to kind of bypass digestion, bypass all of those side effects, and get you the 4 or 5 grams in a lot more of a pleasant way. And then the way that vitamin C in the bloodstream exerts its effect on the body by getting to those higher concentration gradients is by demonstrating its antiviral properties.
Gotcha. Okay, great. So we're coming to a close here, but I just want to ask, is there anybody that shouldn't get an IVs, or is anybody really a good candidate?
Yeah, that's a great question. So in my practice, most of the people that I see are relatively healthy. in the sense that, they care about their health, they're taking active steps towards managing it, and by the time I've gotten many of my patients to an IV, it's after we've again laid down the groundwork of healthy nutrition, healthy lifestyle factors. We've evaluated their medications and made sure there's no interactions there as well. So, there are some people that have medications that we need to be careful of. Medications that drop your blood pressure. They need to be taken into account. It just changes the way that we approach a patient, but we can still treat a patient with high blood pressure. Some clients that have uncontrolled blood pressure, that's a different story, right? If it's controlled, we can handle it, but if it's uncontrolled, and that's why we do a blood pressure monitor on every one of our clients, is to make sure that they don't have excessively high blood pressure, because in that case, we don't want to add more fluid into their system. More fluid we add in, that means more hydraulic pressure, which means more stress on the heart. Okay. That's one client. Some clients just have very difficult veins. So, I'm pretty good at what I do and I have a pretty good track record. But for some clients where they know nurses hate to see them, doctors hate to see them because every time they try to give blood, there's, 6 pokes later. For those clients, we talk more about maybe finding some key professional grade strength supplements that they can take orally, or we talk about intramuscular injections instead. So this is just like an influenza shot that you get at the back of your arm. We can do this for those clients where maybe an IV isn't right up their alley. There's a few other conditions like, people that have uncontrolled kidney disease. The kidney is so important for filtering out excessive amounts of proteins and nutrients in our body. And so if we give you a little bit extra B12 that your body doesn't need, we're expecting the kidneys to eliminate that for us. And so there's no real concern giving you water-soluble vitamins in an IV. The body can just eliminate those through your urine. Somebody that has issues with their kidney, we do need to sort of approach them with a little bit more kid gloves. We might start them on a smaller dose of a bag. We might start them on less of a concentration, or maybe more of a single ingredient as opposed to a cocktail of nutrients, so we can sort of see what's working and what's not. And then in some cases, we just decide the risks aren't worth it at that point. But for the most part, that's why you want to see a naturopathic doctor, right? You don't want to be going to somebody that's not qualified.
Mm-hmm. 100%. And, you've been a breath of fresh air. Clearly, you know what you're talking about. Your great personality. Really enjoyed having you as a new addition to the clinic.
Thanks for my first podcast under my belt.
Yeah, I don't know. You look like an expert. Honestly, IV therapy, it's fantastic. Anxiety, sleep, liver detox.
Yeah, these are all things that, with a full, thorough history and a visit with a naturopath or a qualified healthcare professional that does this, there might be some benefit there for you. So the proof is in the pudding. We usually recommend a trial of at least 2 or 3 treatments over the course of 1 to 2 months, and we'll tailor the formula based on your individual needs. We'll change it up based on your response to the first and the second go, and then at that point we can decide whether this is something that adds value to your life, or whether we want to try skinning a cat another way.
Okay. And what's the cost of an IV?
Yeah, they can range anywhere from $120 up to $250, depending on, again, the severity of the condition we're treating, and sort of how much time we have on our hands, if we want to sort of, throw everything but the kitchen sink on the first treatment, or if, we want to layer things in and start with more of a conservative approach, start with a single ingredient and then see what's working for you. So, if you have any more questions, don't hesitate to reach out to Matt or to myself, and I look forward to hearing from you all.
Very cool, very cool. Glad to have you on. I generally has some curiosities about this, but I feel good about it. So you can obviously come see me or Dr. Jatish here at Proactive Health Group, downtown Calgary, or see us online at Proactive Health Group, right?
Yeah.
And so thanks for coming on. Really appreciate it.
My
this
pleasure.
was delightful. And thanks to all our listeners. Have a good one.